Afar region is a land of contrasts, where the harsh beauty of its topography defines the lives of its inhabitants. The livelihood of the Afar people is deeply rooted in pastoralism and trade. With its touristic flair and geological marvels, the Afar region has long been a magnet for explorers and tourists. Despite its attraction, the region is exposed to climate shocks with erratic weather patterns threatening the livelihoods of its pastoralist populations. The Afar region faces several challenges, including food insecurity and prolonged malnutrition, water scarcity, floods, outbreaks, and drought, which all threaten the well-being of its residents. In the remote and challenging topography of the Afar region, access to healthcare has always been a struggle. There are large distances between healthcare facilities and the scattered communities they serve, which makes it difficult to provide services. To address this issue, the government introduced the Mobile Health and Nutrition Team strategy, bringing healthcare services directly to the people. This strategy is a government-led initiative aimed at providing regular healthcare services at regular intervals to ensure that no community is left behind. Through traditional information exchange systems, the extensive network of the community knows the schedule of the mobile services. Now, members of even far-flung areas have reduced their travel time to 1/4 of what they usually would be traveling, receiving all essential services free of charge. Despite having limited resources and basic infrastructure, healthcare workers continue to increase the number of patients served year to year. There are plans to institutionalize the Mobile Health and Nutrition Team strategy, ensuring that healthcare services are sustainable and accessible to all in the Afar region.
I'm currently in my 3rd trimester and facing a lot of challenges with my pregnancy, which has been considerably tougher than my previous ones. I live in a remote area and the nearest facility for antenatal care is half a day's journey from my home. Unfortunately, I don't have the financial means to afford transport or the associated costs at the hospital. As a result, my only option is to rely on the mobile health clinic that visits our area once a month. It's crucial for me to get checked regularly, not just for my own health, but also for the well-being of my 3 children. The clinic services have been invaluable, especially now as we face a severe drought that might force us to leave our home. I'm truly grateful for the medical support we receive. It's a lifeline in these trying times.
Due to established trust with the community served, along with robust partnerships with government agencies and community leaders, the Mobile Health and Nutrition Service has stayed ahead of the curve, able to pivot and innovate health systems. Our goal is to continuously expand and scale our work to make quality healthcare accessible to all. In June of 2021, the conflict in northern Ethiopia spilled over into Afar, displacing over 300,000 people. Afar Health Center was one of the most important health facilities in Afar. Over 60 health facilities were damaged and looted, displacing healthcare workers, many of whom have not returned to the region. Along with regional and federal government, AMREF collaborated with local partners and donors to restore Afar Primary Hospital. Afar's resilience combined with AMREF's expertise merged to improved what is possible. The extensive damage to infrastructure, coupled with persistent unease among residents and healthcare professionals, necessitated dedicated psychosocial support. This, in turn, demanded a high degree of coordination and collaboration between the Ethiopian government and various partners to reconstruct Afar's healthcare system. In the wake of the conflict's destruction, the Afar Health Center underwent not just a restoration, but a substantial enhancement, elevating it to a primary hospital. This transformation stands as a testament to extraordinary resilience in the face of hardship. This enhanced facility now offers surgical operations and neonatal intensive care unit services, providing advanced services for the community. The Afar people show incredible strength facing environmental and social challenges, with steadfastness that is both essential and inspiring. Continued coordination and collaboration with the government of Ethiopia and partners is needed to rebuild Afar's health system. Together, we can achieve lasting health change.